Good morning. This is Dr. McDaniel. I'm a board certified obstetrician gynecologist in New York City, and I'm bringing to you all things health related for women. Thank you for joining me at the corner today. I know it's been a while, but I'm glad you could join me and that I'm able to give the presentation today. So let's see. Today, I wanted to speak on a topic that I've been trying to inform my patients in the office since the new year came around, and that's that as I like to say, the powers that be, the American College of Obstetrician Gynecologists, they have slightly morphed the definition of the well women's exams. So the visit for the well women's exam is what we used to call the routine GYN check, or the annual checkup, or the GYN, the annual with the PAP. Some people say I'm here for my annual with my PAP, or my routine GYN check. So the routine GYN check, or what we now call just the well woman's exam, has been kind of honed down, and there are several reasons for that. First, the American College has recommended, or we call ACOG, they have recommended that these well women's exams are still done every year, but the well women's exam is just the exam. So it's the breast exam and the pelvic exam. So technically, it's just the breast exam and the pelvic exam. That's it. Now, for gynecologists, we just focus on the reproductive system. So we're not general practitioners or family practice doctors or your adult medicine doctor. The adult medicine doctor is supposed to do the whole body. So they look at your eyes, ears, nose, throat, heart, lungs, all of that. Reflexes. GYN, we're gynecologists because we're not doing the whole body. We chose to be gynecologists because we're just focusing on the reproductive health of women. Now, an extension of that is oftentimes we manage some small breast problems. So the breast exam is thrown in there simply because a lot of the general doctors don't often do a breast exam. I've had a lot of patients tell me that over the years. And also because it's an extension of the reproductive, because the breasts are a hormonal organ. And obviously for the pregnant patients, breast issues can come up for when they deliver, postpartum. Breast issues can come up when they're nursing. Obviously, they will usually see us as the gynecologist. And for just the general woman at large, anyone can potentially obviously have breast problems. A lot of those problems can be hormonal related. But as gynecologists, as far as the breast are concerned, we have a threshold for how much management of the breast we are able and willing to do, because we're not trained as subspecialists for the breast. We are trained as specialists for the reproductive organs, which is the uterus, the ovaries, the cervix, and then an extension, the vagina and the vulva. But we're not trained to manage the breast. I get a lot of patients who come to me asking about anal issues or rectal issues because it's part of their genitals. It's down there with the vagina. We're not trained to manage anal or rectal issues either. That's a colorectal surgeon, or what we used to call a proctologist. As gynecologists, we're just dealing with what I like to tell people, the lady parts. All we're dealing with is the lady parts. That's what we did we do an extra 4 years of training past medical school and our residency. So we're just dealing with the reproductive organs. So the well women's exam is just the breast exam and the pelvic exam. Nothing else, no frills, because I tell my patients, no frills. It's the breast exam, the pelvic exam. The only thing we could potentially add is the PAP smear. And that's because the PAP smear is no longer a part of the well women's exam. The PAP smear is no longer mandatory, it's optional. And because the PAP smear is no longer mandatory, it's optional, as I warned some of the patients, and I've had feedback from some of the patients, not all of their insurance plans will necessarily cover or pay for the PAP smear because it's no longer mandatory. And because the PAP smear is optional, it may fall under your deductible for your labs, or your co-insurance for your labs. So, or if you owe like a copay for your labs, you may be billed a copay by the laboratory or by the medical office if they're taking part in processing it. Usually it's an outside or an external laboratory, like Quest or LabCorp, or BioReference or Sunrise. So the well women's exam or that routine GYN check, the routine annual at the PAP, is no longer mandating that you do your PAP smear. The PAP smears are optional. Now, the American College of Obstetricians and Gynecologists would like for everyone to do their PAP smears every 3, if I can get that 3 in there, every 3 to 5 years. And not every single year. Now, part of that's going to be up to the judgment of your gynecologist because as the recommendations go, if you've had a problem, and we have a lot of different abnormalities or issues with the PAPs and the cervix that can come up. So depending on the problem, if you've had a problem within the last 3 to 5 years, then you may not be available to skip. It may not be warranted for you to skip your PAP smears. You may be, depending on the abnormality or the issue or the diagnosis, you may need to get your PAP smears every year or every other year. But if you haven't had any problems with your PAP smear in the last 3 to 5 years, can I get a 5 in there? Yeah, 5 years, then the recommendation is to do the PAP smears every 3 to 5 years. And in addition to that, they have stated that once you reach 65 years old, if you have not had any problems with your PAP smear in the preceding 5 years, so since you were 60, then you should stop doing the PAP smears. So just as a recap, the well women's exam or the old routine annual, the annual PAP, is still recommended to do every single year, but the PAP smears are no longer mandatory, they're optional, and the recommendation is to do them every 3 to 5 years and to stop at 65 years old, depending on what your specific personal history and potential issues that have come up with your PAPs in the cervix. Now, I'm going to go into some details on the next couple of presentations on exactly what the background and the rationale and the thought process was behind recommending that we don't do the PAPs every single year. We do them every 3 to 5 years based on some of the feedback and the questions that I've received from my patients. In addition to that, I'll go into some detail on questions that have come up with the well women's exams also in the next couple of presentations. So stick with me. I'll do some more presentations, but essentially the take-home message for this presentation is the PAP smears are no longer mandatory, they're optional, and the recommendations to do your well women's routine exam every year, but to skip the PAPs, depending on what your history has been over the last 5 years, and just do the PAPs every 3 to 5 years. Thank you for joining me at the corner today. Please hit the like, subscribe, follow buttons. Check out the YouTube channel. I have everything in the playlist there. Have a great rest of your day. Bye. Good morning. This is Dr. McDaniel. I'm a board certified obstetrician gynecologist in New York City, and I'm bringing to you all things health related for women. Thank you for joining me at the corner today. And the last presentation I just presented the skinny on why the American College of OBGYN has kind of redefined or tightened up what the well women's exams are. So the well women's exam or the routine GYN check, the annual PAP, is still recommended to be done every single year, but it's the breast exam and the pelvic exam. It's with or without the PAP smear because the PAP smears are no longer mandatory to be done every year with the well women's exam. The PAP smears are recommended according to the ACOG to be done every 3 to 5 years. Did I get my 5 in there? Yeah, I got all 5 fingers. Yeah, every 3 to 5 years, and that's the thought process behind that is severalfold. So the first rationale is because in general, now of course, these are always public health recommendations. We're not going to be able to apply these recommendations for every single person on the planet. So in general, whenever these kind of recommendations are made, it's because it's going to help or it's going to cover the situation for 80 to 85% of the population that it's affecting. So 80 to 85% of women. It's not going to affect every single woman, and everyone's going to have an example. I have patients that I've seen who've had problems in a very short amount of time. They've had normal pap smear, and then suddenly it's almost cervical cancer. So everyone's going to have a situation for that. That's possible. But in general, for the 80 to 85% of women, it's going to take 2 to 3 years for the cervix to go from completely normal on the pap smear to severe precancer, very early cancer. We have to go and treat her to prevent her from developing cervical cancer. So in general, it's going to take 2 to 3 years. That's why they're saying you don't need the pap smear every single year, because for the bulk of women, there's always going to be exceptions, and I've seen them myself in my patient population. I've seen women go from normal to severe precancer in 12 months, but the bulk of women, and that's what we're dealing with, the bulk of women, the recommendation is the 2 to 3 years, because most women are not going to go from a normal cervix to severe precancer in 12 months. It's going to take 2 to 3 years. And the second behind that is because realistically speaking, the Gardasil vaccine has decreased for at least the younger population, has decreased the frequency of HPV activity. I think most women, and if they don't, I'm going to say it now, most women know that the Gardasil vaccine does not cover all of the strains of HPV. It covers 7 out of the 14 high-risk strains, the high-risk strains. There's over 180 strains of HPV and counting. The aggressive ones, which are the 14 that I'm referring to, they can cause problems or severe precancer cancer changes within a 3-year time frame on average. Now, there are highly aggressive ones, 16, 18 to 45, that can cause problems within 12 months. And we have special recommendations for women who have had evidence that they have any of the highly aggressive ones. If you have any of the other kind of general aggressive 14 high-risk strains, on average, it'll take the 2 to 3 years to go from normal to severe precancer. And the vaccine, the Gardasil HPV vaccine, helps decrease the propensity for 7 out of those 14. Now, obviously, if you've seen my videos on the Gardasil, the HPV vaccine, you know that it doesn't last forever. Not everyone's going to mount a response. But again, we're not looking at the trees, we're talking about the forest. There's going to be women, and we know that from experience with previous vaccines or current vaccines actually, that don't mount a response to the Gardasil when they get the vaccine. So the 7 that they're supposed to get the protection from or get help from, they're not going to have, and we're not going to know that because we don't have a blood test for the HPV strains that the vaccine is to cover. So not everything applies to every single person. That's why you have to individualize it for certain circumstances. But in general, for the younger population, it will decrease that HPV activity a bit. So they'll get a little bit of help from that. And then if you get the PAPs every 3 years, I'm more leaning towards the 3 years, even though I know the recommendation is 3 and extend to 5. There's very few younger women who really should do the every 5 year skip in my opinion. Perhaps if you're older, if you have 20 or 25 years worth of pap smears under your belt, you've never had any problems, then you can afford to skip and do the every 5 years, because the likelihood that you're suddenly going to have severe activity from the HPV is fairly low. Now, of course, that being stated, of course, the caveat would be maybe you have a huge health change or health issue or a life stressor, because we know that the vaccine is more active when your immune system is compromised. It's only the immune system that can suppress or modulate the viral activity if you have the HPV. So if you have HPV, you know you have HPV, or you can just assume maybe you're in that like 65% or so of the population who has it. If you haven't had any problems with your pap smear, your life's been pretty pretty stable, pretty, I don't want to say predictable, but I want to say pretty stable, pretty balanced, then the likelihood that you're suddenly going to have an issue with HPV is very low. Now, if you're, say, 40, 45, 50, and then you have a huge life stressor, a divorce, a death in the family, you have an illness that compromises your immune system, then yes, you should consider not doing the every 5 years, but dropping down to the every 3 years for the PAP screening, because your immune system is compromised with any kind of stressor, and that can definitely allow, if you have HPV, for the virus to be more active, and then you can have problems. So everyone will have to individualize that for themselves. But realistically speaking, for the vast majority of women, 80–85%, you can afford to do the every 3 to 5 years. If you haven't had any life stressors, you don't have any big issues going on, you don't have any health problems that are compromising your immune system, you haven't had any problems in the last 5, especially 10 years. And if you're young, if you've gotten the Gardasil. If you got the Gardasil, but now you're like 30, 35, then the odds are that it's not going to be beneficial anymore, because the research showed that the vaccine only lasts about 5 years, maybe 6 or 7, but in general, they said approximately 5 years is how long that vaccine will last. And then let's see, before I finish this one, was there anything else I wanted to say about the time frame? No, I guess the last thing would be, which has come up with my patients a lot, is what if they skipped a few years inadvertently? So they're come back, they laid low a little bit before, and then during the shutdown from the pandemic, and now it's already been 2 or 3 years. The rules still apply as long as you didn't have a problem. If your last PAP smear in 2017 or 2018, there was an issue, and now you're coming in 2023, then obviously you're almost at the 5-year mark, but there's no sense extending it to 5 years because you had an issue before you finished. So if there's any extenuating circumstances like that, even if it was last year, if last year your PAP was fine, but now you have a stressor, or now you have a new health issue, then you might want to do the PAP smear 1 year later to see what the status is. So you want to make sure that your health status, your environment, your stressors, or kind of emotional and mental state has been pretty balanced and even keel over that 3 to 5 years. If you've had any changes, then you want to do the PAP smear. So those are my thoughts and my recommendations on the PAP, because we can never take everything as a cookie cutter. We have to use some personal background and personal history for the patient, for the individual. So that's being said too, I also want to kind of underscore that I've had a lot of patients coming in from other gynecologists who are telling me the doctor just refused to do the PAP. She said, you had one last year, or you had one 2 years ago. It was fine. You're not due for your PAP smear this year. I'm not doing it. But she doesn't know if there's been any stressors or any health issues that may have affected potential HPV activity unbeknownst to her, because you haven't had a PAP in 2 years. So if you're told that by your gynecologist, you had a PAP last year, or you had a PAP the year before, you're not getting one this year, I give all of my patients an option. So I tell them what the recommendation is. American College of Obstetrician Gynecologists is recommending that PAPs are only done every 3 to 5 years. But if you're uncomfortable with that, or if you have a concern, I'm happy to do your PAP smear for you. I just want you to know what the standard of care now is. And I say that because I don't know everything that's going on. So that allows the patient to give me any background information that she's not sure. And a lot of people do that. They'll say, well, such and such happened, or they'll say that they had, oh, you haven't read my history yet, because I say that when they first come in, before I've gone over their history and everything. I tell them right at the beginning, this is what the well women's exam is now. And they'll say, oh, but they'll say they were diagnosed with cancer, or they had this illness, or even if they don't say it, they just go, okay. When I go through their history, if I see they were diagnosed with cancer, which of course is an inflammatory disease, or they have a new illness, or they say they got COVID or something's going on, then I'll say, well, With health issues, you might want to consider doing a few extra ones before you skip to the whole 3 to 5 years. Get a few normals under your belt, especially if you haven't had one, didn't have one last year or the year before. You may not want to go straight to the every 5 years. You may want to do the 3-year mark now. Or if they had a big issue last year, I've had several patients who had like mastectomies and things just last year. And I'll say it's probably a good idea, they'll ask my opinion, I'll say it's probably a good idea to do the PAP just to make sure that everything is still normal. And then if it's normal this year, you can skip it next year. So I think that's important information on how to kind of judge for yourself if you should do your PAP or if you should skip your PAP at the time of your annual. Next presentation, I'll come back with a bit more information on why they're recommending to stop the PAPs at 65 and on some other things to take into consideration when you're doing your well women's exam. So I hope that was helpful information and not too rambly on the definition of the well women's exam in 2023. Thank you for joining me at the corner. This is Dr. McDaniel. I'm in New York City, so if you want to come by and see me as a patient, I'll be more than happy to see you. I've had quite a few ladies who have seen me on the YouTube, more commonly the YouTube than the Facebook, but see me on the YouTube or listen to my podcast and want to come in to see me as a patient. Thanks for joining me. Hit the like, subscribe, follow button. That gives me some feedback on the presentations that you enjoy watching or listening to. Have a great rest of your day. Bye.